Hello, my name is Esther with the KoR Whitening System. Thank you for inquiring about KoR Whitening. We've never had the opportunity to discuss KoR and what it can do for your practice and your patients, so I'm just sending you this quick video to cover some of the key benefits of how KoR can help you get the very best whitening results every time, every patient. I've been with KoR Whitening for 9 years, and I have seen us help with some of the most amazing smile transformations. Now, before I dig into what KoR can do for your practice, I do like to go through what it is we already know about teeth whitening systems that you've tried. We do know that you're getting inconsistent and disappointing results. Lights and lasers, we know by now there's no science behind them. They are expensive and they take up a lot of room in your operatories. Too much sensitivity. Lights and lasers, the extra heat you're putting on the teeth is not helping to get the result, but it does add to sensitivity, and we want to avoid discomfort for your patients. Uncomfortable whitening trays. So a patient, they're not going to be compliant at home if the trays that they're using are bulky, if they leak the gel and they're gulping gel at night. And of course, then this all leads to unhappy patients, which is not something you want. You want to help your patients, not make them unhappy. And then, of course, this ends up with frustrated staff. Now, understandably, your staff is not going to advocate for a product they don't believe in, which is a shame because teeth whitening is the foundation for other cosmetic dentistry. When you do whiten our teeth successfully, it's amazing the additional work we want to have done after that. We just want to keep going and fix all those other little imperfections. So let's talk about whitening gels. The cold truth is heat is the enemy of whitening gels. Whitening gels are peroxide. Heat does degrade peroxide, and it happens rapidly. So if gels are manufactured and not put immediately into refrigeration, their potency is destroyed. And the higher the temperature they're exposed to, the more the degradation to the gel. So we want to make sure that your gels are constantly protected, and KoR Whitening is the only whitening company to continuously refrigerate their whitening gels. That means that every time our gels get to your office, you know, even in storage and shipment, they were under protection with cold, and they're incredibly potent every single time. Now, one of the other key components to KoR Whitening, it's the KoR Seal whitening trays. Now, you know, when you make a conventional bleaching tray, that saliva and sulcular fluids will get in, even if you've scalloped the tray. And what happens is that saliva and the sulcular fluids will start destroying the bleach on contact. So maximum whitening time you're going to get here is 30 minutes down to the incisal edge. However, with the KoR Seal trays, these are precisely made to each patient. They are scalloped, and they're going to close and seal right at the gingival margin. That's going to keep saliva and sulcular fluids from getting into the tray, and it allows the carbamide peroxide to stay active up to 8 hours while your patient sleeps. So the longer we keep the gel active, the more staining debris it's going to remove. But you've made trays, so you know it's difficult to get a good adaptation on the lower anterior teeth. That's how close we get it. So that precise fit means you're getting maximum whitening effectiveness because you're going to have patient acceptance. They're comfortable. Saliva and sulcular fluids means not getting into the tray, means no contamination of the gel, and you're going to have up to 8 hours of continuous whitening. So we offer 4 different systems. We want to have a solution for any whitening candidate that comes into your office. KoR Home is perfect for the patient who's a typical case. They want a great result at a great price. We have our Max system. Max is also for your typical whitening case. This one's going to get the absolute widest result they can reach. It combines at home and a single in-office visit. We offer Ultra. Ultra is going to be for your difficult cases. So you have a patient who has fluorosis or a patient who's older and the teeth have just organically gotten darker from aging. Those are your Ultra candidates. And finally, we have Ultra T. Ultra T is specifically for a patient who has tetracycline staining, and I have just seen the most amazing things happen with our Ultra T system. When our patient uses our night gel, it's 16% carbamide peroxide, and the max is a combination of the night gel, 16% carbamide peroxide, and 34% hydramide peroxide is the KoR in-office gel. If you've never heard of hydramide peroxide, it is proprietary to KoR, but it is a hydrogen-based whitening gel with a buffering system. The KoR protocols all start with the KoR impression. Our impression, if you're doing an analog impression, would be PVS, so a putty and a light body wash. And if you do digital impressions, that's great. We also accept digital impressions if you'd like to use our lab. Next, the KoR seal trays are fabricated. Now, these can be made in your office. We'll give you the instructions on how, or they can be made here at our lab. The home and max go right into 2 weeks of at-home whitening. So the home completes the 2 weeks, they're done, they're on to a periodic maintenance at home. They can do that so they can still drink their coffee, tea, and red wine, and that'll just keep the teeth from restaining. Max does 2 weeks of at home, a single in-office visit, and then periodic maintenance. Ultra does a jump start, 3 to 4 weeks of at-home whitening, and then the final in-office visit. And then tetracycline does the jump start, 6 to 8 weeks of at-home, and then the final in-office visit. So tetracycline cases have a longer treatment plan, but these are also your most motivated patients. Now, sensitivity, of course, is an obstacle with whitening. So what does KoR do? Well, refrigerating the gels helps us keep the gels from breaking down, so they're not breaking down into acid from the ions they break down into. The constant refrigeration is used as our stabilizer, which means there are 0 chemical stabilizers in the KoR whitening gels, and our gels have a neutral pH balance, which is going to cause significantly less sensitivity. We typically see low, and in some cases, no sensitivity to your patients. We also will provide you with our potassium oxalate desensitizer. We whiten the teeth. We pull all the staining debris out of the tooth structure, and they're the dentinal tubules, which have smear plugs, and unfortunately, those smear plugs get removed with the staining debris. The tubules are left open, and of course, this is going to cause, for numerous reasons, sensitivity to your patients. So our potassium oxalate desensitizer is applied to the facials of the teeth. It's going to instantly close the tubule back up. It does it by bonding to the hydroxyapatite molecules in the peritubular dentin and the enamel, and it's profound closure. Our desensitizer is amazing for whitening and other dental sensitivity issues within your practice. So KoR makes your patient smile, but we're going to make you smile too because you'll have a whitening system that you can offer with complete confidence. You also know this is going to be the best investment for your patient because they're just not going to get white teeth when they finish the treatment. They're going to keep that result for a lifetime. And the best part, they can still drink their coffee, their tea, their red wine. Their periodic maintenance is going to keep their teeth a beautiful white smile. And also perfect for any age and any case. I've seen patients as old as 92 use our system and get a great result. And, your teenager who just got their braces off, they can use our home system. Great result. So KoR, when you talk about confidence in a product, this is the only system that can get results for the worst possible whitening candidate to come into your office. That's somebody with tetracycline staining. We can take a very severe case of tetracycline like this, turn around and get results like that. So if we can do this, imagine what we can do for just your typical everyday whitening candidate. Thank you so much for your time. If you have any questions, please reach out to us at info@evolvedental.com, or you can dial one of these phone numbers on your screen. One of our account managers will be happy to assist you further. Thank you again. Have a great day, and we look forward to speaking with you soon.